Okay, look, we might get started now. Welcome everyone to session 3 of the Victorian Trades Hall Council's OHS Basics Month series. I wish to acknowledge the Wurundjeri people of the Kulin Nation, the traditional owners on the land on which Victorian Trades Hall Council stands, and pay my respects to their elders, past, present and emerging. This land was stolen and never ceded, always was and always will be Aboriginal land. My name is Dominic and I work at the OHS team here at Victorian Trades Hall Council. The OHS team would like to thank our sponsors at Slater and Gordon for their ongoing support with all our OHS activities. Today, we're going to be talking about psychosocial hazards, bullying, workload, and other psychosocial hazards too. To do this, we are joined by Clay O'Brien, who works as a lead organiser at the Australian Services Union. Clay has been a union organiser since 2013 and has represented workers in early childhood education and care, the Victorian public sector, corrections, so that's public and private prisons, and local government. Clay has previously trained as an HSR and an ARIO permit holder. He has designed and delivered training for union delegates and HSRs regarding worker representation, consultation, and identifying and resolving health and safety issues. And he's also the project outreach officer of a WorkSafe funded program addressing psychosocial hazards in local government and community services. So we're very lucky that he's willing to share his expertise with us today. Before I hand over to Clay, just a bit of housekeeping. I'd ask everyone to keep their microphones on mute so as to avoid feedback and other background noise. This session will be recorded and we will upload it on our website and make that available for everyone if you want to watch it again or for people into the future. We will be running a question and answer session afterwards. We will stop the formal recording once the session's complete, and then we'll have a more informal Q&A, and people are invited to take themselves off mute and turn their cameras on for that. If we do run out of time, there is an opportunity to ask further questions. We do send out a feedback survey, which we encourage everyone here to fill in. And we will write to everyone who's RSVP'd as well with the information. I think Clay's mentioned that he's willing to have these slides shared as well. So we'll send you a link to the slides and whatnot in a few days' time. Fantastic. On that note, I'd like to hand over to Clay. Thank you very much.
Thank you very much, Dom, and it's a great pleasure to be here and to be involved with such a fantastic event as OHS Basics Month. So I'm grateful to Trades Hall for the opportunity, and thank you all for joining us this afternoon to have a discussion about bullying, workloads, and other psychosocial hazards. I will just commence with the presentation. So. Everybody's come along to this event this afternoon knowing that we're going to be talking about psychosocial hazards, but I'd just like to begin with an acknowledgement that we are talking about workplace factors that can impact upon people's mental health. If this presentation raises any issues for you, if you're experiencing or living with a mental illness and need some support and assistance, absolutely encourage you to reach out to one of the professional services that's listed up there on the screen. Lifeline is the number that I have committed to memory on 13 11 14. They do fantastic work. They're available 24 hours a day, 7 days a week. And so if this presentation raises any issues for you whatsoever, absolutely encourage you to reach out to one of those services for support and assistance. Just anticipating the question and answer session after the formal presentation, I'd also just mention that, we all bring various backgrounds and experiences to these discussions. And so whilst, we absolutely encourage and welcome people to share their experiences and to, raise any questions that they may have, just ask you to do so in a way that's mindful of the fact that people may be experiencing or living with mental illness. They may be encountering a workplace situation that is causing them harm, or indeed carrying trauma from a previous experience as well. So just in terms of setting the scene, why psychosocial hazards? Why is this a big focus? Why is it something that Trades Hall and other unions are really passionate about? It's because it's no stretch or exaggeration whatsoever to say that we are currently living through a mental health crisis in this country. What we know is that 1 in 5 Australians experience a mental illness in any given year, and almost half of us, if we haven't already, will experience a mental illness at some point in our lifetime. According to the Australian Bureau of Statistics, mental and behavioural conditions are the most common chronic conditions in Australia, followed by back pain, arthritis, and asthma. And mental health has been described as an epidemic by the Australia Institute. We also know that this is a workplace issue. Workplaces are full of things that can impact our mental health, and psychological injuries are the fastest growing category of workers' compensation claim, both in Victoria and Australia-wide. And so all of this leads very neatly to a question of, well, is our workplace mentally healthy? Is my workplace mentally healthy? And what we know is that stress, and in particular acute or prolonged stress, can be incredibly harmful to both our physical and our mental health. So if it follows that if you're experiencing significant stress either at or because of your work, then that's likely to be causing you harm. And that's never okay. It's never okay to be harmed by our work, our workplace, or our working environment. Now, I'm going to talk a little bit about a survey that the ASU ran back in 2022. Now, this survey was run in Victorian local government, but I think the experiences that it speaks to are actually quite universal. And so we ran a significant survey of mental health in local government, where the majority of respondents said that their workplace was negatively impacting their mental health. We found that psychosocial hazards were shockingly common. And far from suffering in silence, what we found was that the majority of people who had experienced a psychosocial hazard in their workplace had actually raised or reported their concerns to management, but just 1 in 4 received a satisfactory response. What we found was hundreds, if not thousands, of examples of cases being dismissed, of being swept under the carpet, of complaints going nowhere, or in the absolute worst of cases, of people being victimised and targeted for having spoken up and raised their concerns in the first place. What we found was that shockingly high percentages of people said that their workplace was negatively impacting their sense of self-worth, that it was negatively impacting their confidence, that people felt nervous or anxious about coming to work each and every day, that their workplace or their working environment was negatively impacting them even after they went home, or that their workplace or their working environment was negatively impacting their sleep. Most importantly, what we found was that workplaces and employers generally tend to be pretty good at talking the talk, of saying the right things, of saying that they care about mental health, about caring about health and safety, that their employees are the most important people to them, but they are shockingly absent when it comes to walking the walk and actually making the changes that are necessary to protect you and keep you safe. What we also found was that people generally didn't make the connection between experiencing a psychosocial hazard or a mental health concern in their workplace and then protection that exists under the Occupational Health and Safety Act. So what is a psychosocial hazard? For anybody who's unclear or perhaps a little bit uncertain about what I mean when I talk about a psychosocial hazard, a psychosocial hazard is defined as anything in the management or design of work that increases the risk of work-related stress, which can lead to a physical injury, a mental injury, or even both at the same time. Now, the most common psychosocial hazards are listed up there on the screen. They include low job control, which can be micromanagement, high and low job demand, so that's the workload pressure or the emotional and psychological impact of the work that we do. Poor support, poor organisational change management, poor organisational justice. That basically refers to unfair treatment in the workplace. Low recognition and reward, low role clarity, conflict or poor workplace relationships, violence and aggression, bullying, harassment, including sexual harassment, poor environmental conditions, remote or isolated work, insecure work, and violent or traumatic events. Now, this is not a comprehensive list because the definition of a psychosocial hazard is anything in the management or design of work that increases the risk of work-related stress. But it's important to note that for these common psychosocial hazards, there's no debate about whether or not they increase the risk of work-related stress. It's an established fact. They absolutely do. And I'd also just make the point that for these psychosocial hazards, every single one of the hazards listed up on this screen have been recognised and talked about for in excess of 20 years. So there's simply no excuse for employers to be caught flat-footed about these hazards, or to not know or be inadequately addressing the risk of these psychosocial hazards in the workplace, because they've had 20 years to get this right. Now, as a part of the work that we've been doing, we've been gathering data on the experiences of psychosocial hazards in the workplace. And so this is what some of the data looks like so far. Now, really just making the point here that if I'm experiencing something that causes me stress in the workplace, it is extremely likely that there are other people in the workplace that are experiencing that same issue as well. What I struggle to think of a single psychosocial hazard that can cause a risk to my health and safety, but not cause a risk to the health and safety of others in the workplace. But what we know often when dealing with psychosocial hazards is that the response tends to be very targeted and individualized, rather than looking at the systems and the systems level responses that can be put in place to protect people and keep them safe. And so this data really just serves to reinforce the point that if I'm experiencing something in the workplace that causes me stress, it's extremely likely that other people are as well. And that if I'm experiencing a psychosocial hazard, I'm not alone in that experience. And we need to be able to talk about it, and make sure that people understand that these are collective issues that have collective problems. Now, this is just the same data, but represented a different way. And it really just reinforces that point, that when we think about whether or not we are likely to experience a psychosocial hazard in our workplace, what we know is that more than 97% of workers say that they have. Now, why does all of this matter? It matters because there are significant and proven causal links between psychosocial workplace hazards and mental illness, poor health, and even death. There was a study that was published in 2021. It was a French study that looked at all-cause mortality, that's death from all causes, in almost 1.5 million people between 1976 and 2002. It was the first study of its size and length in history. And what they concluded was that psychosocial workplace factors were responsible for almost 5% of all deaths. That's 1 in every 20. There's been other studies as well, but the one that I'd also just direct your attention to was some research that was published by 2 Stanford professors in 2020, where they found that psychosocial workplace hazards were as harmful to health as secondhand smoke. Now, I, like many people, spent a part of my late teens and early 20s working in pubs and bars and hospitality, back when you could smoke inside pubs and venues. And we banned that. We banned because of the impact that it was having on people's health. And the research that tells us that psychosocial hazards are just as harmful as secondhand smoke, and they need to be treated just as seriously. Now, it's on this point that I'd just like to remind everybody that every single one of us has a right to a workplace and a working environment that is safe and without risks to health, so far as is reasonably practicable. You are here at this event in OHS Basics Month talking about psychosocial hazards, so everybody here already knows, of course, that the concept of health under the Occupational Health and Safety Act includes psychological health as well. And so when we say we've got a right to a working environment that's safe and without risk to health, so far as is reasonably practicable, we are absolutely talking about our psychological health as well. Now, the most effective and important mechanisms under the Health and Safety Act for delivering a safe workplace are effective representation of employees through your elected and trained health and safety reps. If you don't have health and safety reps in your workplace, there's a process under the Act for you to get some, but also you can speak to your union as well. Effective and genuine consultation on any matters that may impact your health and safety. And it's also important to remember that we have a right to effective issue resolution under the Occupational Health and Safety Act as well. Now, the key thing that I'd like to draw your attention to is that the Occupational Health and Safety Act says that we have a right to a workplace that is safe and without risks to health. And that particular right was summed up really perfectly by the Victorian Supreme Court of Appeal, where the court found that an employer's duty under the Act is to ensure that employees are not exposed to risks rather than to prevent a particular accident. So if we turn our minds back to the list of psychosocial hazards that I showed you a moment ago, it does not matter what the risk is, whether it's bullying, harassment, unfair treatment, lack of support, lack of role clarity, workload pressure, exposure to violent or traumatic events. It does not matter what it is that causes the risk to health and safety. Employers have a legal duty to protect you by not exposing you to that risk in the first place. That's not my opinion. That's the finding of the Victorian Supreme Court of Appeal. Now, when we think about the concept of a mentally safe workplace, this is what we are talking about. And the important difference to be recognised is that there is a difference between employee wellbeing and safety. Now, we know that employers love to pat themselves on the back. They love to talk about their wellbeing initiatives. There's a lot of investment going on in this area. There's no shortage of initiatives when it comes to employee wellbeing. And if you raise or report an issue or a mental health concern in your workplace, I guarantee that the first response that you're going to get is, well, here's the number for EAP. Or have you thought about taking some sick leave or some time off work and sort yourself out, and then you can come straight back into the working environment that's causing you harm in the first place. The important difference is that all of the wellbeing initiatives and injury management practices in the world don't actually satisfy an employer's obligation to provide a workplace and a working environment that is safe and without risks to health. And the common element with employee wellbeing and injury management is that neither of those things actually solve the problem. Neither of those things will actually fix an issue. And what follows is that the hazard will continue to expose workers to risk of illness and injury. And that's never okay. So this slide is just all of the suggestions that were in the green section of the graphic earlier. But these are what we would say are fundamental elements of a mentally safe workplace. So safe work practices and systems of work. Now, the example that I like to use here is in relation to workloads. Now, inevitably, if you're experiencing high workloads, it's likely to be, we've got all of this work that's coming in, or all of this work that needs to be done, and we can't afford to put on more people to do that work. Or, we've had people leave at the workplace and we can't afford to replace them. Now, even if that is true, even if an employer genuinely cannot afford to put on enough staff to do the work, that is not the end of the discussion. They still have an obligation to ensure that there are safe work practices and systems of work that enable that work to be done safely and in a way that does not unreasonably or unnecessarily create a risk of stress for those who are doing that work. Do you have proactive, effective, fair and transparent workplace controls? For example, in relation to known hazards like bullying, harassment, sexual harassment, and workplace conflict. Do you have fair, reasonable and transparent issue resolution procedures? If you raise or report an issue or concern, is it going to be dealt with? Are you going to be treated fairly? Is everybody in your workplace held to the same standard? Is the most powerful and senior person in the workplace held to the same standard as the most vulnerable and most junior person in the workplace? Do you have effective and genuine consultation processes? Every single workplace has a right under Section 35 of the Act to effective and genuine consultation on any matters that may impact your health and safety. Is that happening? Is your employer able to explain how and why they've arrived at a decision if they haven't taken your advice and suggestions on board? Do you have a strong and active network of elected and trained health and safety representatives in your workplace? And do you have fair and reasonable, transparent workplace policies and procedures? Now, these are just suggestions because it really falls to you as the people in the workplace, alongside your elected and trained health and safety reps, to identify what is needed in your workplace to ensure that it is safe and without risks to health. But I'll just make one point in relation to this list, which is that there's nothing radical about anything that I've just suggested or proposed. These are basic and fundamental elements of a mentally safe workplace that you are all entitled to. Now, some of you might recognise this tool, the hierarchy of control. Now, the Occupational Health and Safety Act says that you're entitled to the highest level of protection against risks to health and safety in the workplace. And Section 20 of the Act says that if there's a risk to health and safety, that the first priority is to eliminate the risk, and only if it's not reasonably practicable to eliminate the risk, then you've got to reduce the risk. Now, using the hierarchy of control is how we determine what is the highest level of protection against any risks to health and safety. Now, it can be quite confusing to try to apply the hierarchy of control to a psychosocial hazard, and oftentimes, it can be confusing about, well, we can't eliminate the risk, but do we use an engineering control, a substitution control, or an isolation control to reduce the risk? The terminology does not matter. The terminology doesn't matter. What I would encourage absolutely every single worker to do, if there is a risk to health and safety in the workplace, think about the best and most effective way to make that situation safe, and then work with your colleagues to push for that resolution. It doesn't matter whether, strictly speaking, it's an engineering control, a substitution control, or an isolation control. All that matters is that we are safe, that we've got the right to return home safe and well at the end of the day, and that we are pushing our employers to ensure that they absolutely comply with their obligations, but most importantly, that our workplace and our working environment is as safe and without risks to health as is reasonably practicable. So what is reasonably practicable? Well, it's defined under the legislation. And Section 20, subsection 2 of the Act says that regard must be had to the following matters when determining what's reasonably practicable: the likelihood of the hazard or risk eventuating, the degree of harm that would result, what the person concerned knows or ought reasonably to know, the availability and suitability of ways to eliminate the risk, and finally, the cost of eliminating the risk. Now, it would truly stagger most people to know how many employers we encounter that believe that reasonably practicable means whatever they want it to mean, or that something is reasonably practicable just because they say it is. But very fortunately, WorkSafe have actually released their position on how they apply the law in relation to reasonably practicable. And what WorkSafe says is that what's reasonably practicable is an objective test based on the standard behaviour of a reasonable person that's committed to providing the highest level of protection and is proactive in taking measures to protect health and safety. The test involves a careful weighing up of each of those 5 measures that I just mentioned, with a clear presumption in favour of safety. And in relation to cost, WorkSafe says that once the likelihood and degree of harm is established and the availability and suitability of ways to eliminate or reduce the risk has been understood, then that safety measure should be implemented unless the cost of doing so is so disproportionate to the benefit that it would be clearly unreasonable to justify the expenditure. And very importantly, WorkSafe says that what's reasonably practicable in relation to cost is not determined by reference to capacity to pay. If an employer cannot afford to do something safely, then they should not do that thing. Now, knowing and understanding all of these things is an essential precondition to effective issue resolution. It stands to logic that in order to effectively participate in an issue resolution process, we need to know and understand what our rights are and what our employer's obligations are. And so the really neat thing about the Occupational Health and Safety Act is that it treats employers and employees as two equal parties. The entire point of our legislative system is for employers and employees to work together to identify and resolve any risks to health and safety in the workplace. If you can't agree on the best way to do that, then the appropriate next step is for a HSR to consider exercising their powers, or you can contact WorkSafe and request the assistance of an inspector as well. So if you are experiencing a psychological risk in the workplace, whether it's excessive workload, bullying, whatever it might be, the first and most important thing is to make sure that you raise the issue. That should be done formally and in accordance with any relevant policies or procedures exist, but the absolute first thing to do is to make sure that you raise that issue. Once the issue has been raised, doing nothing is not an option. The Occupational Health and Safety Act says that once an issue has been raised, the employer must attempt to resolve the issue. It's not optional or discretionary. They must attempt to resolve the issue. So what that looks like is engaging in effective consultation about the best and most effective way to make the situation safe and to resolve the issue, agreeing upon appropriate controls as an equal party to that discussion and decision, implementing controls, noting that it's the sole responsibility of the employer to implement controls, and then finally monitoring the situation and escalating if necessary. A few of the fundamental takeaways that I'd hope that you take from this presentation is that when it comes to your health and safety, there's no such thing as a too hard basket. We have a right to be safe at work. And also, you're not alone. If you're experiencing a psychosocial hazard in the workplace, it's a very safe bet that you are experiencing a collective issue. And so talking to your colleagues, collectivising, seeking assistance from the union or from WorkSafe or from your HSRs is a absolutely legitimate thing to do. If you are experiencing or living with a mental illness, speaking up is so important, and really encourage you to reach out to one of the professional services that I listed earlier. And Lifeline, is available 7 days a week, 24 hours a day. And then just remembering that we've got that right to a safe workplace, and not accepting that your workplace or working environment causes you harm or places you at risk. Now, as a part of our WorkSafe funded project, we developed an online toolkit. And so if you scan that QR code, that'll take you to the ASU website, and the link is on the screen there as well. Our online toolkit is filled with resources. All of them have been reviewed and approved by WorkSafe Victoria. They are free and publicly available. There's a whole bunch of resources there, tools to identify and resolve psychosocial hazards, as well as general information about health and safety, and about your right to be represented and elect your own health and safety representatives. And I will finish on that note. I'm really grateful to Trades Hall for the opportunity. Please visit the website if you need any further information, and I'll stop sharing my screen, and we can commence the Q&A section.